Hi, my name is Dr. Jared Toman. I'm an orthopedic surgeon in Heywood Healthcare. A lot of patients come to see me when they have pain in their hips and their knees due to arthritis. And even though both joints are both on the leg, all right, they're both involved in getting us around, they're very different. And the way that they're treated is also different as well. Knee arthritis, we can try injections, therapy, even arthroscopy. We have a lot of different tools at our disposal. Hip arthritis, yes, we still try the non-operative modalities first, but it's a little more difficult to definitively treat. The reason is that when a hip wears out, the ball and socket joint can never really relax. I mean, when my patients come in with hip pain, they have pain when they sleep, they have pain when they stand, they have pain when they sit. It's a toothache that's very hard to get away from. And although it can be made worse by activity, sometimes rest hurts just as much. So typically the hip arthritis population, when we've tried the easy stuff first, wants to go towards something more definitive a little sooner than the knees. When a patient and I come to the mutual decision that a hip replacement is probably their best course of action, I'm very proud to be able to offer them the anterior total hip replacement. What I think is special about the anterior approach, though, is it is the only way into the hip that does not deliberately cut or disrupt musculature. And I think that's very important when we're talking about a quality of life procedure. I've been doing this for a little while now. I can make a much smaller incision. I feel it enables me to match and balance the anatomy better. And I think that's especially important to keep in mind. Even though we focus on replacing the bones, we're still leaving the capsule, the muscles, everything around that hip that has spent many, many years, decades, learning how to function and being familiar with functioning in that specific geometry. Basically, the anterior hip makes me feel as though I'm offering this elective quality of life procedure to my patients in the best way that I possibly can.